Hello everyone, my name is Ronnie Smith. I'm the acting director here at the Ralph H. Johnson VA Medical Center here in Charleston. I wanted to reach out to you to let you know what we're doing here to be prepared for the coronavirus and do everything we can to protect you, our veterans, and all of our staff. A lot of this happened over the last several weeks and a lot more is to come, but we wanted to touch base with you real quickly, let you know what we're doing in response to the coronavirus. To keep our patients, staff, and community safe, we're operating under modified operations in response to coronavirus. All of our outpatient clinics are providing as much care as we can virtually to the greatest extent possible. I did want to update to let you know, to date we have had 1 employee and 2 medical residents test positive for the coronavirus, and we've had 1 veteran test positive for coronavirus, which we were notified about yesterday. So we knew at one point we would start seeing positive patients and staff, and that time has come. We know we'll have more in the future, and so a lot of the things we have done is to be prepared for this and to know that we're going to be facing this situation for a long time to come. For those staff, we've notified everyone that's been in close contact with them for appropriate follow-up, and we'll continue to do that in the future when we have future employees that test positive. But because of privacy issues, we can't get into any other details related to those cases. As you may know, our VMC and all of our clinics have limited entrances into each location. At the main campus here in Charleston, we've limited our entrance to the west entrance for the public, and all of our clinics have limited to 1 entrance. Everyone that's coming into the building is going through a screening process. We're asking for certain symptoms such as fever, cough, shortness of breath, and in the very near future we'll be taking temperatures at the door. We give everyone a bracelet or something else to indicate that people have gone through the testing process and screening process to make sure they're okay to come through the building. In addition, we're limiting as much traffic in the door. We've done such things as limiting the number of volunteers that we have in the building. We love our volunteers, but many are older and more susceptible to coronavirus. And so we've limited our volunteer force from entering as well during this time. For staff, many staff that we are capable, we've put them to telework options. So while we're also providing virtual care to many of our veterans, we're also limiting the number of staff in the building to create as much social distancing as we possibly can, but still to try to provide great care to our veterans. We've made sure to equip our staff with appropriate PPE, our personal protective equipment, following our CDC guidelines. And we're doing everything we can to limit the number of elective procedures, tests, and visits that are not quite necessary at this point in time, that we can safely shift to a later date in order to make sure we have the PPE we need available to our staff when we know we have more cases come in. We haven't yet had an inpatient coronavirus case, but once they do, we know we'll have a greater demand for the PPE for our staff to safely care for our veterans. We have, in our inpatient side of the house, set up 2 special zones particularly for treating coronavirus, and 1 for in our ICU and 1 on our med-surg wards, and we already have plans in place to be able to expand those as we see more cases in our community and in our facility. And as you know, on March 24th, we did go to a no visitor policy. This is regrettable, but this is a necessary step to protect our staff and our veterans. The more people in our building, the more susceptible we are to spreading the coronavirus, so we're doing everything we can to limit visits to the facility. We do have staff available to escort veterans that need assistance to their appointments. But for most cases, we're not allowing visitors. Visitors are being asked to wait outside until the appointment is being completed. We are making some limited exceptions. The same applies for our community living center. Areas where our most vulnerable veterans are in our hospital. And so we have a very strict no visitor policy for that during this time. Only limited staff are being allowed into the community living center, and they're being tested extensively for any signs and symptoms of coronavirus before they're able to enter every single day. So only limited staff can enter the building, trying to make sure that area stays as safe as possible. The only exception we're making is for very certain end-of-life situations. Some other things we've been doing around the facility to create as safe environment as possible is we've moved our chemo infusion clinic into separate rooms so that we don't have as many people in one location for immunocompromised veterans. We have closed our dining rooms. The dining room still provides food, but our waiting area, we have closed that, much like many restaurants in our communities have done as well. And we're also taking very safe precautions with some of our employees. We have created a lot more telework options and rotating staff, but those that are high-risk employees, we're doing everything that can to provide alternate means for them to continue to provide their service at home or other locations to minimize their exposure. We want to take care of our employees just as much as we want to take care of our veterans. And then we have a few other things we're working on that will be coming here in the near future. And we will continue to make adjustments as we learn more about the coronavirus and those that have been dealing with this before it becomes to the greater Charleston area. We are currently working on on-site testing for the coronavirus. We'll soon be able to do in-house testing in our own lab. And we're also working on having a drive-through location for people to have outpatient testing when it is deemed necessary here at our main Charleston campus. That is all for now. We'll be in touch soon. Thank you very much. Stay safe. Make sure you're washing your hands with soap and water and keep your good social distancing. Thank you.